Hello, everybody, and welcome to the 8th meeting of Bright Garden Voices. My name is Diego Ardoan, and I am one of the co-founders of this project. I will start sharing my screen to share our slideshow. Oops. There we go. So, Bright Garden Voices is a grassroots initiative which provides a platform for constructive dialogue between Armenians and Azerbaijanis. We host online meetings and events where guests from both sides share their experiences and ideas related to the Azerbaijani and Armenian conflict and issues surrounding it. Each meeting also includes an audience member participation. The meetings are recorded and made available online. Our project, Bright Garden Voices, is not affiliated nor funded by any organization or government and does not purport to represent any state or group. Today's meeting, as you know already, it's about mental health and war. And we ask ourselves, how does the conflict between Armenia and Azerbaijan affect the mental health of both populations? How do soldiers and civilians in these two societies deal with the trauma of war? And what is the status of mental health in both countries? For today's meeting, we will introduce our guests right away. For today's meeting, I'm joined by two new debuting hosts from our project, Aysel Guseynova and Mariam Yegasarian. They will introduce themselves in a bit. First, I'll introduce myself very briefly. My name is Diego Ardoan. I'm one of the co-founders of this initiative. I've studied geography here in Buenos Aires, Argentina, focusing on Armenian studies. And as I've always been involved in peace and human rights activism, that's how I got involved in this project. And now I'd like to invite Mariam Yegasarian to present herself.
Hello, everyone. My name is Mariam. I'm a freelance journalist and a documentary filmmaker based in Yerevan, Armenia. I'm interested in human and non-human animal rights, environmentalism, cinema, and also I'd very much like to mention that I'm dealing with mental health on a very personal level. So I'm very excited and honored to co-host this meeting.
And now Aysel, she was having some connection issues. I'm not sure if she's here already to present herself. Otherwise, we'll do that later. Okay, Aysel, are you here already? Okay, she'll introduce herself then when she's able to rejoin. So now we'll go to Mariam to go through today's agenda very briefly.
So at first we'll have a discussion with our guests. And then if you have any questions, you can forward them directly to our moderator, or you can wait until the end of the discussion and then ask them yourself if you have your camera on. If you don't want to use your real name, you can have you can use only your name or surname, or choose a nickname for you. And also be aware that the meeting is going to be recorded and available later on online. And at the end, we'll have closing remarks as well.
Yeah, so if you have any questions, you can send them privately to Arnold, one of also of the co-founders of the project, Arnold Alaverdian. I don't know if you want to say hi so everybody knows who they should send the questions to. I'll go through the house rules very briefly. Basically, we try to keep this a safe space, so we avoid anything that can be provocative or aggressive towards anybody. Our project does not seek to reach a conclusion or a common idea between everybody. The idea is that we can have different ideas, different points of views. We don't need to convince the other of anything. So agreeing to disagree is okay, and of course respecting the other, stories and pain is also important. So denialism is not tolerated, and we seek to empathize rather than blame, right? So as you can see in the screen, this is basically the house rules. So as long as you maintain these house rules when it's time for the questions, everything should be fine. Just some people still joining. Welcome everybody who's just joining now. So now we'll introduce our guest. Mariam, if you want to introduce first.
Yeah, so Rovshan Suleymanov is a clinical psychologist from Azerbaijan. He did his Bachelor of Arts in International Economic Relations from Azerbaijan State Economic University. He also holds a Master of Arts on Marketing Management from Eastern Mediterranean University of Famagusta in Cyprus. Later, Rovshan did his master's degree in clinical psychology at Art University in Social Sciences and Humanity in Warsaw, Poland. And he's trained in cognitive behavior therapy and worked with adults having depressive and anxiety disorders in Baku. After the Second Karabakh War, he moved to Barda, and currently he's working with people affected from the Second Karabakh War.
Great. And now we'll introduce Artur. I think Aysel has just joined. So
she's
Aysel,
joining right now.
Joining right now. She'll
a few seconds.
So just a few seconds. Sorry.
Just admitted her.
Okay. While she joins, I'll introduce Artur then. So Артур Тоноян was born in Gyumri in Soviet Armenia. He began his studies in psychology at the Gyumri State Pedagogical Institute, later earning his master's degree in psychology from the Urartu University of Practical Psychology and Sociology. He's currently a candidate of psychoanalysis at the Paris Psychoanalytical Institute. Arthur is the executive director of the Armenian Psychoanalytical Association, and he has been a member of the International Psychoanalytical Association, Paris Psychoanalytical Association, Paris Institute of Psychosomatics, and ASM 13 Mental Health Association. He has worked as a clinical psychologist, lecturer, or director at various state, educational, and private institutions. Arthur has also worked as a clinical psychologist with soldiers affected by the recent war. Arthur loves reading, traveling, and learning, and he simply loves life. So thank you both, Arthur and Rovshan, for joining us today. And I might mention as well that for today's meeting, Arthur will have an interpreter helping with translation. So I also want to welcome Armine, and thank you, Armine, for joining today. That means that when Arthur's talking, after a few sentences, Armine will be translating to English. So yeah, just to let you all know about that detail. So I don't know if Aysel's online or available. Otherwise, we'll jump to the questions. Aysel, if you're there. She's our other or Azerbaijani host, but I'm not sure if she's there. So yeah, I'm not sure. So okay, I'll start with the questions, and then she can take up from there. So the first question.
Hi.
Is that you, Aysel?
Yes, I'm so sorry. Yeah, that's fine. I've got it working now. Sorry about that. Sorry to keep everyone waiting.
Don't worry.
It's just one of those days.
Want to introduce yourself briefly, and then you can ask the first question to Arthur.
Right, no problem. Yeah, no problem. Right. So hi guys. Yeah, I'm Aysel. Sorry again for my my lateness. I'm an Azerbaijani that was raised in Lithuania, and I'm currently residing in the UK for the last 20 years. My interests are drawing, reading, asking a lot of questions, to be honest, and I just love learning about different cultures. And I usually like to hang out with my dog a lot. I've been obviously living outside of Azerbaijan. You might think I'd have met or spoken to a few Armenians in my life, but actually I've only encountered a couple of them. Sadly, you know, that's one of the reasons why I was so interested in finding a dialogue and why I joined Right Garden Voices, because I wanted to have some sort of engagement and have experiences of my own in that regards as well. So I'm sure Diego has already filled in for me in introducing Artur as well, and probably went through the other bits as well. So we'll just carry on where we left off. So it's a question to Artur. So what inspired you to choose a career in mental health? And is there anything about your background or past experiences that inclined you to do so? Where did your interest come from?
Բարև բոլորին եւ ուրախ եմ բոլորին տեսնել ես հարթակում ինձ կօգնի Արմինեն որ թարգմանը
Hello everyone, I'm happy to be here and Armenia will help me for translation.
Ես փոքր տարիքից շատ եմ ուզել դառնալ բժիշկ ու մինչև 15 տարեկան պարապում եմ բժշկական ինստիտուտ ընդունվելու համար Եվ բայց 16 տարեկանում հասկացա, որ ինձ ավելի շատ է դուր գալիս լսել մարդկանց ու բացահայտել։ Ու իմ սերը միֆոլոգիա եւ փիլիսոփայության հանդեպ եւ իմ հետաքրքրասիրությունը ինձ դարավ դեպի հոգեբանություն։ Եվ արդեն լինելով հոգեբանության ֆակուլտետի ուսանող, ծանոթանալով հոգեբանության հետ եւ կարդալով Ֆրեյդի առաջի գիրքը Три очерка по теории сексуальности խորացրեց իմ հետաքրքրությունը դեպի հոգեբերլուծություն ինչը ինձ տարիներ հետո բերեց դեպի հայկական հոգեբերլուծական ասոցիացիայի դռան մոտ իսկ ասոցիացիան ճանապարհ բացեց դեպի Փարիզի հոգեբերլուծական ինստիտուտ
So when I was young I wanted to become a doctor And so I was preparing for medical university. But since 16, I could understand that I enjoy very much listening and discovering people and discovering people in a mental sense. Then my love in philosophy and my love for mythology brought me towards psychology and also my curiosity. So I was student at psychology faculty when I read my first book of Freud, 3 essays on sexuality, which deepened my interest in psychoanalysis. Years later, I appeared in front of Armenian Psychoanalytical Association door. And then years later, through that door, I appeared in front of Paris Psychoanalytical Institute.
Thank you very much for that. Yes, that was very insightful. So let's see. I think the next question should be passed on from Miriam to Rovshan.
Yeah, we have the same question for you, Rovshan. Could you please tell us what inspired you to choose a career in mental health, and if there's anything in your background or past experiences that inclined you to do so? And tell us a bit about your interest, where your interest comes from.
Thank you. First of all, thank you for inviting me tonight for this discussion. As you heard from my biography, I started to study psychology after doing my bachelor and master degree in different fields. When I did my master in marketing management, we had a brilliant professor of management, Jem Tonova, who taught us organizational behavior. And there I first time started to hear questions about experiments on social psychology, why people obey, why people confirm others. So these kind of questions took me to psychology. And then I started to read a bit, then to Google a bit, to watch YouTube videos about those experiments, those very interesting experiments. And then I started to wonder that, and I liked that feeling And somehow I switched to clinical psychology. Why some people get depressed, why some people are more anxious than others, etc. So nothing special. This has just happened to me. Thank you.
Okay, so I think it's the next question for Artur again. How common is it for people in Armenia to seek help for mental health issues? What's their level of awareness in both the government and the society? And do they have like respect for mental health issues?
No, I think you skipped the question.
Oh, no, where do things stand in Armenia?
No, we did not skip the question, actually. That's the second question.
Is the right question? Okay, sorry.
So that's the question.
Okay, thank you. Հոգեբանությունը Հայաստանում ցավոք սրտի զարգացել է եւ մուտք է գործել 88 թվականից հետո, երկրաշարժից հետո, եւ 88-ից արդեն թերապևտիկ հոգեբանությունը մտավ Հայաստան, եւ չնայած սովետական կարգերին շատ հոգեվերլուծողներ ներգրավեցին տրավմատիկ աշխատանքի մեջ։ Եվ հիմնականում Ամերիկայից, Ֆրանսիայից։ Երևի Արմենիան այսքան թարգմանեց, հետո շարունակեմ։
Շատ լավ. The psychological support, psychological therapy, in fact, started its functioning in Armenia starting from 1988, when I have to add when Spitak devastating earthquake happened in Armenia. And those Soviet rules and Soviet period, several psychoanalysts came to Armenia for post-traumatic recovery work. And they were mainly from States and from France. Yes.
Եվ արդեն 91 թվականից արդեն Հայաստանում կային մի քանի հոգեբանական կենտրոններ ու արդեն բացվել էին ավելի շատ համալսարաններում հոգեբանական ֆակուլտետներ։ Եվ վերջին քառորյա պատերազմից հետո հատկապես կառավարությունը շատ մեծ կարևորություն եւ շատ լուրջ աշխատանքներ էր տանում հոգեկան առողջության վերաբերյալ։ Եվ կային արդեն ծրագրեր օգնել կարիքավորներին եւ հոգեբանական ծառայությունը անվճար էր զինվորների, ընտանիքների, հարազատների, անօթևանների համար։
So in 1991, already I can add 4 psychological centers were founded in Armenia. And year by year, faculties and chairs of psychology were opened in Armenian universities. After the last war, the government is giving real importance to psychological support and mental health issues. And they really care, government cares for families, soldiers, and other people to get psychological support, which is financed by state. Yes, which is financed by states. That is.
Right, great. Well, that's good to hear, because we all know how important everyone's mental health is. It's good to hear that there is a positive response to that, because I think we all know too well in a lot of countries, even post-Soviet, that there is a bit of a stigma towards mental health, and some people don't really like to talk about it. So that's really good to hear. Yeah. So I'll pass you on to Miriam now.
Where do things stand in Azerbaijan when it comes to mental health? And we would like to know if what is the level of awareness both in the government and the society in respect to mental health issues. Rovshan?
Yes, well, I would definitely say that the awareness is raising, mainly because of social media and TV. So you can find hundreds of Facebook or Instagram pages, which is created by psychologists. And mainly when psychologists create page, they mainly put their clinical psychologist or psychology name before their name, like psychologist Hassanov or clinical psychologist Rovshan Suleymanov. Yeah, and people see this and they start posting about different issues like anxiety, depression, stress, how to manage anger. So these kind of things, they usually this might be one thing that positively impacts to our awareness. I'm not talking about quality at all. I'm just talking about awareness that we day by day we hear and see more. And even if you watch TV shows, and you can see that almost every TV show or program invite psychologists and ask their opinion about different things. So it positively, I think, impacts to the awareness, but the quality is a big and the big question again. We can also observe that there are more and more psychology faculties are opening at universities, especially clinical psychology faculties. And also governments work on this, especially after the Second Karabakh War, after the second escalation. So government created Tabib, which is alternative organization to Ministry of Health. And there is a mental health department under Tabib, and they started to control or organize these psychological services all around the country. Especially the government pays attention to frontline areas, so which were negatively affected from the war. So yeah, according to my observation, the awareness is rising. Not sure if I answered to your question. If you have
yes.
clarification, additional questions, please feel free.
Yes, you did, and thank you very much. And it's very nice to hear that the assistance is decentralized, and especially for the areas that are strongly affected from the Second Karabakh War. Okay, let's switch to the next question, and the floor is yours, Aysel.
So the next question would be, how common is it for people in Armenia to seek help for mental health issues? Who is most likely to seek help? Is it women? Is it soldiers, the young, the old, etc.? And who do they seek help from? And how accessible is it?
Արդեն նշեցի, որ երկրաշարժից հետո եւ պատերազմից հետո կային հոգեբանական կենտրոններ եւ 99 թվականից արդեն կար առաջընթաց այդ դեպի հոգեբան։ Իսկ 2000 թվականից հետո տարեստարի ավելի զարգացավ եւ դիմողների քանակը ավելի շատացան, քանի որ սկսեցին ճանաչել մասնագետին եւ մասնագետներին եւ կառույցներին եւ սկսեցին տարբերակել հոգեբան եւ հոգեբուժ տարբերությունները Armin քան թարգմանեք Արմինե ջան։
As I told already that in Armenia were created psychological centers financed by state already in 1991. So that fact helped population to understand that they can apply for psychological support. And starting from 2000, of course, there was a real progress in that field. Not to forget that people needed time to understand the difference between psychiatric support and psychological support.
Right. Yeah, it's at the end. Sorry. That's great. That's good to hear. 'Cause obviously
I want
there
to
is.
continue.
That's fine.
Yeah.
I was waiting.
Եվ մենք դեռ չունենք հստակ ստատիստիկ տվյալներ, քանի որ դեռևս շարունակում է դիմել մասնագետներին հոգեբանի աջակցությանը եւ հոգեբանի աջակցություն առաջարկում են թե հիվանդանոցներում եւ թե ընտանիքներում ու կազմակերպվեց ծավալուն աշխատանք առաջին իսկ օրվանից ու քանի որ 2016 թվականին արդեն ունեինք փորձ տվյալ ծառայության մատակարարման այս անգամ այդ փորձը ծավալվեց լայնածավալ եւ կարելի է ասել որ դերևս շատ մեծ արդյունավետությամբ
I cannot say exact statistical dates about people searching or asking for psychological help, but I know very well that people continue to apply for psychological support. That psychological support exists, I mean, certain services, they are existing in hospitals. There are some organizations, they provide their services for families going to the families even. So it was a wide-scale work because our main experience about post-trauma support started in 2016 when the small war happened. And so there was certain experience which helped us to be well and quick organized after this war.
That's really good. Yeah, that's really good. Well, I was actually wondering towards the question. So it's a little bit of an extra from me. So since people started to realize the difference between psychiatric help and psychological help, do you feel that's become less stigmatized in society as well? So you will see a lot more talk between each other rather than going to like a professional, because sometimes opening up to friends or family also helps.
Ուրեմն շատ կարևոր է այդ համագործակցությունը հոգեբույժ եւ հոգեբան եւ այս պատերազմի ընթացքում ձևավորվեց մի շատ հետաքրքիր աշխատանք, ինչը Եվրոպայում արդեն այդ փորձը կար մասնագետների համատեղ աշխատանքի Արմին այդքան թարգմանեք
After this war, another how to say type of work appeared when psychologists and psychiatrists, they tried to come together to work in a kind of alliance like this happening in Europe, which again means the kind of progress.
Եվ արդեն քանի որ մենք բավականաչափ փորձ ունենք մեր օտարերկրացի մասնագետների եւ գոլեկաների հետ, որոնք տարիներ շարունակ արդեն 30 տարից ավել իրենք տարին մի քանի անգամ գալիս են եւ վերապատրաստում են եւ սովորեցնում են մեզ այդ կուլտուրան աշխատել բժիշկների հետ համատեղ եւ արդեն ոչ միայն հոգեբուժների, նաեւ այլ մասնագետների
Again, I want to emphasize the experience that we had before, and that in that experience, the important part is that our colleagues, friends from abroad, from different countries, they are really supporting us and organizing seminars, trainings, supervisions, and they are trying to teach us about the culture of working together, not only with psychiatrists, but also with our other medical professionals. And this collaboration has life almost for 30 years. So almost for 30 years, this collaboration is going on with foreign our friends and colleagues. They are mainly diaspora Armenians living in different countries.
Եվ արդեն դա ոչ թե ամոթ էր հոկեբանի մոտ գնալը, որովհետև հասկացան, որ հոկեբանի մոտ գնալը դա դեռևս չի նշանակում լինել հիվանդ։ Եվ եթե կան անձնային կամ միջանձնային ընտանեկան եւ ներընտանեկան խնդիրներ, կարելի է դիմել մասնակետի։
And it appeared that people could understand that it is not anymore shameful to apply for psychological help, because to go to this, that does not mean ill. People came to see psychologists when they had some relational problems, some interpersonal or other family problems. So it became very usual for people to seek for help in psychologist's room.
Okay, thank you very much for expanding on that. That's very insightful. So I'll just pass you over to Miriam again.
So yeah, thank you very much. Rovshan, could you please elaborate on how common it is for people in Azerbaijan to seek for help for mental health issues? And again, who is more likely to seek for help? Women, soldiers, young or the old? And who they seek the help from? Is that their friends or a doctor or a counselor or professional? Yeah. And also a very important question on how accessible is it in terms of finances, and then also in terms of the availability of the professionals. Okay,
the question is a bit long. Can you please keep the slide a bit in order to focus?
Yeah. Let's start from how common it is in Azerbaijan to seek for help when someone struggles with mental health issues.
Okay, I just would like to see the question on the screen in order, because it's long and well, how common is it for people? Some people seek for help, some people they don't, but I can say that according to my, I don't also have data, but according to my observation, at least, I can say that well, people started to seek health, to seek help more than before. This is according to my rough observation. And mainly, I would say that young people seek help, people in their 20s, in their 30s, mainly those people. Old people, I wouldn't say that it's common for them to seek mental health help. Mainly, if you have any mental disturbances, in Azerbaijan, people mainly go to neurologists, so to doctor, and they prescribe some psychiatric medicines. This is very common. If you go to rural areas or other cities of Azerbaijan, other regions, this is very common. But in Baku, it's different. People, it's also because the psychiatric help and psychological help is reachable in Baku comparing to other regions. But about asking help from religious leader, I haven't seen any. About friends, well, when people have disturbances, they usually talk to friends. If at some point, if they see that they can't, it doesn't help, they may go to the psychologist. I know that I give very vague a bit answers, not precise, because I don't have that precise data. So this is why I'm asking in this way.
Yeah, you're absolutely doing your best, no worries. But could you please a little bit elaborate in terms of accessibility, in terms of, for example, finances? If someone is from a low income, is it accessible for them to apply to psychologists or even psychiatry?
Can you repeat it a bit, again? I
Yeah,
didn't.
Sure. I wonder if for someone living in Azerbaijan who has a low income, is it accessible for them in terms of finances, or not only for them, but in general for the society, to seek for help when they struggle with mental health issues?
Well, there are some centers that they provide psychological, psychiatric care free of charge. But those centers are very limited, and they are mainly in Baku. So mental health, we know that it's costly. You go to psychologist, like 1 hour, I don't know, 45 minutes or 90 minutes. It's a lot of money. So for poor people, it's very difficult to get that service, and a high quality service. It's very difficult. But there are some places that they provide such services. Does it cover all people? Of course not. Not here, not in Azerbaijan. I believe that many countries it's not reachable. But in our country, no, it covers very limited people. Very limited people.
Thank you very much for answering.
Yes, this is.
If you have anything to add. Yeah.
About soldiers, well, while answering to your previous question, I said that government created a new organization which is called Tabib, and they have their mental health departments. They have their psychologists there, and those psychologists, as far as I know, they call to war veterans, and they ask if you have any difficulties, if you have any disturbances, we can help you. We are here. So I know that government provides this support to those people. But of course, there are so many people that can't get, as I mentioned, high quality psychological help. What else?
I guess that's it so far, and we can move to the other question.
All right.
Okay, yeah. So my question to Artur is, what about in Nagorno-Karabakh? Do you have any knowledge on if there is mental health attention there, or is it mostly based in Armenia? How are the local approaches dealing with trauma, and how accessible is it there in Nagorno-Karabakh? Okay.
Artur.
Sorry. Նույն աշխատանքները տարվում են Արցախում, եւ արդեն առաջի պատերազմից հետո ստեղծվել են հոգեբանական կենտրոններ եւ հոգեբանական ֆակուլտետներ Արցախում.
Almost the same process happened in Artsakh, because after the first Artsakh war, 93-94, in Artsakh was opened one psychological center, and Pedagogical Institute or Artsakh University was opened faculty, psychological faculty.
Եվ նույնը ինչը Հայաստանում թե Արցախում, իրանք բոլորը ստանում են աջակցություն ամենաշատը բժիշկներից այս անգամ
the same is in Artsakh. They get services from doctors and from psychologists.
Հոգևորականներից
Religious leaders also are trying, or religious community members are trying to help as well.
Եվ ընկերները եւ բարեկամները լինելով շատ աջակցող միևնույնն է հիմա հորդորում են որպեսզի դիմել մասնագետների.
We have rather supportive society, and friends and family members are very supportive, but even family members are trying to trying to advise or to let the soldiers or participants, war participants, to ask help with psychologists.
Քանի որ զինվորների իրենց ընտանիքների եւ այն մարդկանց ովքեր աջակցվել են պատերազմի հետ իրենց հետ բոլոր աշխատանքները անվճար են թե հոգեբանական թե հոգեբուժական եւ մնացած այլ բժշկական.
General medical service, psychological, psychiatric support and services are free of charge there, and soldiers, women, family members, displaced people and their family members, they can get free of charge services, psychiatric, any kind of medical and psychological.
Right. Thank you very much, Artur. It's good to hear again that it's so, that's like almost on the same level as Armenia itself in Nagorno-Karabakh and the services it provides. So yeah, thank you again. So moving on to Maria.
So Rovshan, very important question. Could you please tell, based on your personal experience or your research, what has been the impact of the first Nagorno-Karabakh war in the Azerbaijani society?
The impact was devastating. After the first Karabakh war, we had 100,000s of refugees and internally displaced people. And those people, they were settled in tents and in trains. They lived in a horrible situation for for 20 years. Malnutrition, I don't know, poverty. I'm not talking about mental health because government and people were thinking mainly about how to get basic needs. And in such condition, if we imagine about, try to imagine about the mental health problems, that would be like disaster. Also, so after 1993, people, as I mentioned before, used to live in those tents, in those trains, summer, winter, in very bad weather conditions, and the government lost the war, and people were, I don't know, many of people had hope that will come back to their home, but some of them lost their hopes. Actually, there is one good research which was done by Indie Peace. I recently read that research, and that research says how the trauma transmitted to new generations, how that trauma narrative transmitted from one generation to another generation. If you're interested in, I can share it, that research with you. It's in English. I can share it with you. Yes, people, families, they started to talk about what they saw in the war. Thousands of people died, got disabled. Now it's 2021, we can see which kind of difficulties those disabled people or people who lost their loved ones in the war, which kind of mental difficulties, disturbances they live. If we compare, we can see that the previous impact, negative impact of the war was higher than this.
Yeah, please share the paper, and maybe we could also share it on our social media platforms with Garden Voices. But could you please elaborate a little? Were there any mental health services available in 90s or not at all? Or maybe even like later on, like in the beginning, I don't know, 2000s, or I don't know, so that maybe those people could get some help later, at least?
I know that within international humanitarian organizations, there were some help, mainly psychiatric help. So those humanitarian organizations, they visited those tents, those camps, IDP camps, and they provided their psychiatric help. There were International Committee of Red Cross. I only remember this one, but probably there were other organizations, Turkish Kızılay or Iranian Kızılay, those organizations. So within these organizations, yeah.
Glad to know that they have it.
But not much.
Yeah.
Attention was because government didn't have that capacity to do this. Yeah, this is why it gone unnoticed. So.
Thank you very much.
Okay, well, we know that the first NK war also had a huge impact for Armenian societies. Do you think that the intergenerational trauma of the Armenian genocide has had some role in the latest Nagorno-Karabakh war and the conflict in general? If yes, how so?
Անկասկած միջսերնդային տրավման մեծ դերակատարություն ուներ եւ կոլեկտիվ չափրված սուկ արդեն 5 սերունդ առկա է Armenian թարգմանի
Without doubt, the intergenerational trauma transmitted from generation to generation is alive, and this is a kind of not really overcome mourning that is still in process. Already the 5th generation still in the process of mourning.
Եվ դեռ չմշակված գենոցիդի տրավմաները
and the genocide not processed traumas are around.
Եվ 88-ին ունեցած երկրաշարժը, որը ուղեկցվեց պատերազմով, այդ ամենը շատ մեծ տրավմա էր հայերի համար, որովհետև գենոցիդին գումարվեցին եւս միանգամից երկու աղետալի տրավմաներ եւ միանշանակ այդ ամբողջ տրավմաները մեծ հետք թողեցին հայազգի վրա, ինչը բնականաբար եւ ազդեց ժողովրդի եւ հիշողության հայերի գենետիկ Armenian թարգմանի
So the non-processed side, but also in 88 when earthquake happened in Armenia, it was devastating. It was totally traumatizing event. Then of course before Karabakh war already huge amount of refugees, displaced people from Azerbaijan appeared in Armenia. Then the war started. I mean, and so of course all these terrible memories are around, and the intergenerational problem is around.
Եվ միանշանակ գենոցիդի ազդեցությունը դեռ շատ մեծ է եւ դա հայերի մոտ փորձում են մենք միասին մեր կրոնական ծեսերով, պատմության միջոցով, նաեւ գենոցիդի ճանաչման միջոցով ախտահարենք այդ սուքը եւ ապրենք Armin.
There is no doubt that the influence, the impact of genocide, the impact of that huge trauma till now is living with us and is with us. And we are trying, of course, to overcome through some memorials, events, remembering or things that are important to help, and of course to fight for recognition as well, which is a part of the whole process to overcome the trauma.
Եվ Հայաստանում մի քանի տարի առաջ ունեցանք մեծ գիտաժողով տրանսգեներացիոն խնդիրների հետ կապված.
We had a big conference, international conference in Armenia several years ago on intergenerational transmission of trauma.
Եվ բայց արդեն քանի որ 88 թվականից MDM-ը եւ MSF-ը Հայաստանում ծրագրեր էին անում.
But as since 1988, two French organizations, Médecins du Monde and Médecins Sans Frontières, MSF and MDM, were implementing some mental health projects in Armenia.
Արդեն աշխատանքները սքի ապրման արդեն սկսված էին այդ ժամանակաշրջանից.
Already that time became it was evident that the mourning process is not connected with the earthquake, but it is the transgenerational mourning which was evident during the clinical work.
Բայց մենք գիտենք, որ մասնագետները եւ ով առնչվել այդ հարցերին, այդ սքի ապրման, կոլեկտիվ սքի ապրման ամենամեծ ազդեցությունը ճանաչել։ Եթե չեն ճանաչում, ուրեմն մերժում են, իսկ մերժումը շատ դժվար է։
And you know that this mourning process has an interesting character. Specialists, they can prove that one of the ways to help to overcome that type of trauma, of course, is the recognition. And because denial is making worse to overcome. So this is a kind of collective mourning process going on so long.
Yeah, thank you very much. I think we can all agree that there is no winners or losers. in war as well, and that, you know, it affects both sides in the end. You know, only kind of people are usually affected the most, especially ordinary people, you know. So thank you very much. Yeah, on to Mariam.
Sorry. Rovshan, I'd like to ask the means and which methods and theories do you use to approach trauma? Dealing with the traumas of the Azerbaijani society. Which methods and which theories and which approaches do you prefer personally as a clinical psychologist?
You mean me personally or in general?
You personally, but if you'd like to elaborate on others as well, yeah, you're welcome.
Mm-hmm. I use behavior theory, and the name of therapy is called prolonged exposure therapy. It's a evidence-based psychotherapy, which means its effectiveness was scientifically proven by several researchers. What is prolonged exposure therapy? So people experiencing trauma, they have disturbing memories, thoughts, then that makes them feel fear, anxiety. And because of these unpleasant emotions, people, in order not to live this anxiety, people try to avoid those thoughts, those pictures, even those places that reminds people or triggers those anxiety. And what prolonged exposure therapy do, the idea is that to expose person to those disturbing images, thoughts, and not to avoid it. The logic is this. And while we do it, we realize that these thoughts, these images are not, there is no any more threat, because people having post-traumatic stress disorder, there is an unresolved threat. So threat is always there, and people, this is why having post-PTSD, they feel tense, they can't concentrate to do anything because there is threat. If we feel threatened, we can't do anything. So fight and flight response, that survival mechanism will be active, and we will not be able to explore, to enjoy life, to do anything but to do something in order to survive. So in prolonged exposure therapy, you slowly expose person to his or her thoughts and emotions. There are like several ways of doing this. One of them is called Imaginal Exposure. People start talking about those memories. For example, I was in war, this happened, and my friend was died, and I witnessed this and that. So people start talking about these details, and of course it's terrifying. People get very afraid, it gets very tense. But despite this, he continues to do this. And then later at home, we record it and as a action plan or homework, people, those patients listen it at home. So after some time, those memories and thoughts doesn't create that intense reactions. So other type is exposing those things in reality. So not imaginary, but we call it in vivo exposure. So facing those things in reality. So let's say that the city center of Barda was shelled, and now patient afraid of going to that place. So she or he bypasses that place, avoids that place. So step by step, people start to face that place, not to run away, not to avoid that place, but so this is mainly what I use. In our country, mainly psychologists, they were talking. There wasn't special method, but recently our psychologists got training from Turkish EMDR association. EMDR is a type of type of psychotherapy. Eye movement and desensitization, something it's called. The idea also a bit similar. So therapist activates patients' disturbing thoughts, images, and while doing this, he uses external stimuli in order to distract or calm patient. And through this process, the patient processes the trauma. I'm not expert on this. This is the idea of EMDR.
Thank you very much. Our next question. Isa? Isa, are you here?
Okay, can you hear me, guys?
Yes.
Okay, I'll just ask it. By which means of which methods or theories do you approach trauma? Which methods are more prevalent in Armenia?
Isa, there is an echo.
Արդեն նշեցի, որ ես հոգեվերլուծական ասոցիացիայից եմ եւ աշխատում եմ հոգեվերլուծական մեթոդով, որովհետեւ արդեն Հայաստանում 90-ականների սկզբից տրավմատիկ ստրեսների վերականգնման հետ աշխատել են հոգեվերլուծական թերապիան, կոգնիտիվ թերապիան, պոզիտիվ թերապիան, Armenians քանը թարգմանի.
As I told, I am representative of psychoanalytic direction. So since 90s, post-traumatic work was carried out by psychoanalytic approach, positive therapy also, cognitive, you told, Artur, cognitive?
Yes.
Cognitive therapy.
Այս EMDR արդեն Հայաստանում կա EMDR-ի ասոցիացիա.
Of course, EMDR in Armenia we have already association of eye movement, desensibilization, reprocessing. So there is already EMDR association in Armenia.
Հոգեդրաման.
Psychodrama is practiced as well.
Խմբային աշխատանքներ.
Group therapy.
Եվ մեր Շվեյցարիայի գոլեգայի եւ Փարիզի գոլեգաների հետ համատեղ մշակվում է մի նոր մեթոդ, որը աշխատում է հենց տրավմաների հետ.
Soon we are going to get acquainted with a kind of new method worked out by Swiss or French psychologists, which is going to be trained in Armenia. Again, a kind of work for trauma recovery.
Եվ հիմա այդ մեթոդը փորձում ենք աշխատանքներ են տարվում, որպեսզի ադապտացնենք Հայաստանում եւ օրինականացնենք Հայաստանում.
We are trying to legalize and to adopt that method in Armenia, and we work on it.
Եվ նաև կան տարբեր այլ մեթոդներ, որոնցով հիմա փորձում են ավելի կիրառելի դարձնել եւ ադապտացնել Հայաստանում նաև այլ հոգեբանական մեթոդներ, ինչպես նաև արդեն նեյրոհոգեվերլուծությունը, որը դեռևս նոր է Հայաստանում, բայց նաև կա արդեն այդ մի ճյուղը, որտեղ փորձում ենք զարգացնել։
There are other methods too. I know that certain professionals are working to adopt for Armenia, and the last is about neuropsychoanalysis, which again is on the way to be developed here in Armenia.
Եվ Հայաստանում արդեն կան նաև համագործակցություններ հոգեբանների հետ, այսինքն հոգեբանները միմյանց հետ։
One thing is important to mention is there is already good collaboration between psychologists in Armenia.
Երբ որ իհարկե ոչ բոլորը, բայց բավականին մեծ տենդենս կա։ Արմին թարգմանի։
Not all, but there is a real tendency.
Քանի որ եթե մի մեթոդ չի աշխատում, հոգեբանը ազատորեն դիմում է մյուս հոգեբանին որպեսզի ուղղորդի պացիենտին, ասելով որ իր մեթոդը այս պացիենտի հետ բան աշխատող չի։
So the tendency is following. In Armenia, there is a newly established kind of collaboration between the psychologists, because when we work with a patient and there is no success, so we know how to refer that patient to another psychologist who works in another method.
Եվ դա կարևոր համագործակցություն է մասնագետների միջև։
I find it an important collaboration between the professionals.
Եվ արդեն մի քանի տարի արդեն ինչ գործում է ընտանեկան թերապիան եւ հոգեդրաման որպես ինդիվիդուալ մեթոդ եւ հոգեդրաման որպես խմբային մեթոդ։
And last years, two other methods are largely practiced in Armenia. This is psychodrama as individual method and as a group method, and also family therapy.
Okay, thank you very much again, Artur. It's great to hear your opinions and your thoughts. Okay, so passing on to Diego now.
To Mariam, if you want to.
Yeah. So, Rovshan, do you think that giving more voice to mental health victims and mental health experts would have an impact on the way Azerbaijani society view war and the conflict? Rovshan?
Without having peace agreement, not ceasefire, I believe I'm a bit pessimistic in this thing. Without having a peace agreement, that will not have much impact. So first we need to have a peace agreement. So we need to feel, both sides need to feel secure. If we don't feel secure, if we feel threat, all think that we will do is to somehow organize and be prepared in order to prevent that threat. This is what I believe. But of course, talking doesn't hurt. We can do it. People may get, because until that time there were some attempts to do this, but the second escalation showed that those things, people, those empathy who people felt toward other sides, they disappeared within 44 days. This is why, yes, again, I'm saying that the very important thing is to have peace agreement, that we are not threat to each other anymore, and then build things on this. About talking about victims, about mental health, people may feel, of course, empathy toward others, that we can see that, yes, Armenians or Azerbaijani people, oh, they also suffer, they also get traumatized, they also cry, they also feel anxiety, they also have flashbacks. Those people also, I don't know, got depressed. This may help. This may help, but without peace agreement, I'm not that optimistic in this issue. I'm not sure if I answered to this question, but I think I mainly answered to my answer covered mainly peace building process rather than this question. Thank you.
So thank you very much for being honest and sharing your beliefs, and maybe you could just say if mental health experts could help in this regard by being objective and not taking sides, maybe. I mean, mental health experts working with their patients, maybe that them being professional could help, or you still don't think that
Because
that would make a change?
Mainly those professionals, they work in government institutions. So people who work in, who have private practice or who work in international organizations, they may do this, but majority they work for government, and I don't believe that they can do it. They can be, I don't believe it. Sorry for being such pessimistic, but this is what I believe.
No need to apologize. Thank you very much for your honesty, and yeah, and you made a very important remark for both sides. So thank you very much. Isa?
I believe that's the yeah. Do you think that giving more voice to mental health victims and mental health experts would have an impact on the way Armenian societies view war and the conflict?
Ես կարծում եմ, որ միանշանակ դրական ազդեցություն կունենա։ Ինչը նաև եղավ երկրորդ համաշխարհային պատերազմից հետո, երբ հոգեթերապևտիկ աշխատանքը սկսեց լայնորեն կիրառվել։ Արմին թարգմանի։ Միկրոֆոնդ միացրա, Արմին։
Sorry,
It's not going.
I think that without doubt it is going to have a real impact. Not to forget that after the Second World War, when psychology was on its normal level, the mental health workers could help many people. People could get victims and people could get help from mental health workers.
Քանի որ դա առողջությունը դա մենակ հոգեկան առողջությունը չի։ Ասարմին
Health is not, when we say health, we do not consider only mental health.
Հոգեկան առողջությունը դա ֆիզիկական, հոգեկան եւ սոցիալական գումարն է համատեղ միասին։
Health, it means mental, physical, and also social well-being. So all three together, it means health.
Եթե դրանից մեկը պակասում է, ուրեմն արդեն առողջության հարցը դրվում է կշեռքին։
When one of these three components are missing, then we have to measure the problem of health. We have to put on a balance.
Եվ երբ որ դա կատարվում է համատարած եւ կոլեկտիվ, դառնում է շատ ավելի դժվար։
And when it is happening in a wide scale, in a collective form, then the problem is becoming more difficult, more complicated.
Իսկ երբ դրանցից մի ֆակտորը ինքը ավելի կայուն է եւ ավելի ամուր, որտեղ կարելի է հենվել,
but when at least one factor is stable and is rather strong on which you can lean,
կարելի է մյուս թույլ օղակները ուժեղացնել։
You can enforce other two weak parts.
Եվ կարևորություն տալով հոգեկան առողջությանը,
giving importance to mental health,
դա նաև կարևորություն է կյանքի փիլիսոփայությանը.
It means to give importance to a life philosophy.
Եվ հարաբերությունների ձևավորմանը.
And to formation of relations.
Քանի որ հոգեկան անկայունության եւ էմոցիոնալ տաներ վիճակներում մենք բոլորս կարող ենք դատել ոչ ճշգրիտ եւ ունենալ ոչ ճշգրիտ արդյունքներ.
Արտուր ջան, կարող եք մի հատ էլ ասել նախադասությունը, որովհետեւ անջատվեց մի պահ.
Okay. Եվ
հոգեկան անկայունությունից հետո.
Եվ երբ որ կա հոգեկան անկայունություն, էմոցիոնալ ճզմվածություն եւ խառնաշփոթություն, չենք կարող ունենալ ճիշտ դատողություն.
When there is mental instability, emotional confusion, then we are not able to come to right conclusions and to think in a right way.
Եվ միայն ունենալով այդ կայունությունը, հոգեկան կայունությունը, ապահովությունը, մենք կարող ենք ճիշտ որոշումներ կայացնել, չտրվելով էմոցիաներին.
And when we will obtain psychological stability and become into a kind of better psychological state, then we will be able to think, to make right decisions, and not to be emotional.
Քանի որ պատերազմը միշտ սերմացնում է ատելություն.
Because war always is creating hate.
Իսկ ատելությունը միշտ քանդում է ամեն ինչ.
And hate is always very destructive.
Իսկ որպեսզի ազատվել այդ ատելությունից, պետք է զբաղվել կրթությամբ եւ հոգեկան առողջությամբ.
And in order to get rid of hate, we really have to make steps in the fields of mental health and education.
Որպեսզի կարողանանք լուծել խնդիրը, այլ ոչ թե բարդացնել եւ ավելի խճճել.
In order to be able to solve the problem and not to confuse the problem or to make it more and more complicated.
Եվ դրա համար էլ աշխատելով նաև զինվորների հետ դա մեծ կարևորությունը տեսնում ենք հենց այնտեղ։
That's why we work with soldiers and we see real importance, especially there.
Yeah, thank you very much, Artur. I think you did make an important note as well, that, you know, mental health, even as a whole, it's not just a thing by itself. And sometimes even physical health can impact somebody's mental health. So if, you know, if a soldier did suffer an injury, you know, that can affect their mental health as well. So yeah, thank you very much. On to Miriam.
No, we are actually done.
No, oh, I thought we were doing another one for Azerbaijanis. Sorry. Yeah.
So now actually we're stopping the screen share. We're gonna see each other, all of us. So I invite you all to turn on your cameras, as Arnold will now moderate the open, semi-open Q&A session. Okay, so Arnold.
So thank you to Rovshan and Artur for answering our prepared questions. Now we are going to take questions from the audience, and some of you have already written to me in the chat. So let us start. If Alexei, are you still with us? Alexei Tolchinsky.
Չէ, ինքը խնդրեց որ ինքը գնա,
Yes.
քանի որ աշխատում էր։
Okay, so he left, but he did leave a question for me to ask. And he directed it to Artur, but let's ask this to Rovshan also. So if possible, would you kindly share what the day is like for a clinical psychologist working at the front, clinical load, severity, etc.? How profound and lasting, in your opinion, is the mental health influence of war on the soldiers and officers? So I believe we sort of touched on this. So if you would briefly just give us a perspective of your own interaction with soldiers affected by war. Arthur, do you want to start?
Արմին, բայց եկը խնդրեի, որ մի հատ թարգմանե, որովհետև լրիվ իմաստային մի քիչ բաց թողեցի հարցի։
Arnold, I'm sorry, but you have to repeat the question.
Okay.
I'm really sorry.
Այո, հարցն է, որ ինչ է օրիսօր կյանքը, sense որ աշխատում եք զինվորների հետ, որ կրվին են մասնակցել, ոնց է ամեն օր ձեր աշխատանքը, ինձ է շատ հոգնածիչ է, շատ երկար է, ինձ է զինվորների հետ վերաբերումը, որ կրիվ են եղել։
Բնականաբար աշխատանքը շատ բարդ է եւ շատ դժվար։ Արմին.
Naturally, this work is a difficult one, is a complicated work.
Քանի որ աշխատանքը զինվորների հետ առաջին 3-4 ամիսները միայն կամավորականներ էին։
And the first 3-4 months, the work with soldiers was just benevolent work. I mean, volunteers were working.
Եվ շատ կամավորականներ էին աշխատում, եւ հետո սկսեց կառավարությունը ֆինանսավորել եւ այլ հայկական հիմնադրամներ, ինչպես են օրինակ Santa Armeniana.
And then, of course, the government took over that work in a structured way, and other Armenian organizations too. One of them is like Santa Armenia. They took over that volunteer work.
Եվ առաջին իսկ օր ժամանակվանից մեր օտարերկրյա մասնագետները մեզ հասան օգնության։
We really got help from our colleagues and friends living abroad. They really came to help us in our difficult work.
Եվ քանի որ հոգեբանները չունեին նմանատիպ լայնածավալ տրավմայի փորձ,
we really did not have such an experience of such huge trauma, working with such a huge trauma.
Եվ նաև չկար եւ նաև մյուս կողմից բոլորս դրա մեջ էինք։
But also all of us, we were in it. I mean, in a kind of traumatic process.
Եվ որպեսզի մասնագետները չքանդվեն եւ կարողանան հետագա աշխատանքը եւ որպեսզի մասնագիտական այրում տեղի չունենա,
and in order to escape kind of professional burnout, in order to stand for the work,
մեր գոլեգաները online դասընթացներ էին անում,
we passed online trainings,
եւ սուպերվիզիաներ,
seminars, supervisions, trainings.
Եվ անգամ լինելով առաջնագծում, ես փորձում էի ժամանակ հատկացնել, որպեսզի կարողանալ միանալ այդ ամեն ինչին, որովհետև դա ապրացնում էր։
And those supervision seminars and trainings were very positive, efficient, and me as a professional working in frontline, I had to always find time to join those online meetings because it was giving me a possibility to go on to live.
Եվ նմանատիպ աշխատանքների միջոցով էր, որ մենք բոլորս կարողացանք դուրս գալ ամենայն դեպս առաջի փուլով այդ ծավալուն եւ դժվար դաժան ապրումներից.
It was the first period was difficult, it was cruel. Our emotions, our thinking was terribly influenced by the things happening around. So the help of colleagues was too much and it was efficient.
Որովհետև եթե չլիներ իմ գոլեգաների աջակցությունը եւ իրանց մոտեցումը, իրանց պարուրանքը, երևի թե ես չէի կարողանա այսօր այսքան հանգիստ խոսել այդ ամեն ինչի մասին.
If not the support of professionals, if not the support of my colleagues, their approaches, their, I mean, holding and caring for us, probably it would be not possible for me to talk to you today.
Եվ դա շատ մեծ կարևորություն էր, հատկապես դրսի մասնագետների օգնությունը, քանի որ ես անընդհատ շփվում էի եւ զանգում էի շատ ծանր պահերին իմ գոլեգաներին, բայց կար դրսից մասնագետ, ում հետ ես եղել եմ անընդհատ կապի մեջ, ներսում դա Անժելա Վարդանյանն էր, իսկ դրսում Իրեն Նիկոլյանն էր, ով ինձ տեսել է ամենածանր վիճակում, եւ մի մարդ, որը օգնել է ինձ հավաքվել պատերազմի դաշտում.
It was a real support, and I was calling them here in Armenia. It was Angela Vartanyan. I got her support, and from abroad, I got my support from Irene Nikolyan. They helped me to work, to live, and to stand this situation.
Եվ դա մի մեծ կարևորություն էր դրսի եւ ներսի,
It was
որովհետեւ
real important to get it from inside and from outside.
որովհետեւ ներսում այստեղ շատ ներկա են իմ գոլեգաներ եւ ես բոլորից եմ շնորհակալ, բայց իրանք ներսում են եւ ունեին հավաստար տառապանքը տեսնելով այս ամեն ինչը.
Because my colleagues here in Armenia, some of them now are here together with me, I understand that they had that terrible suffering also, and themselves they needed help.
Իսկ Իրեն Նիկոլյանը դրսից էր.
Iran was from abroad.
Ինքը Հայաստանում չէր եւ տանջվում էր, բայց այդ ամեն ինչի մեջ չէր, ներկա չէր.
Know that she was suffering, she was not inside.
Եվ դա օգնեց, որ ես կարողանամ հենվել իր վրա եւ չցավացնել իմ ներսի գոլեգաներին.
And it helped and gave me opportunity to to get her assistant and not to harm my colleagues here who were in sufferings.
Thank you.
Thank you. And I believe we
Thank you.
have Iran here with us, if you want to wave. Thank you for your work, for helping Artur and joining us. Rovshan, hello. Rovshan, I want to ask you the same question. What was it like day to day working on the front lines, working with soldiers? What impact did it have on you or your colleagues working there?
Thank you for the question. First of all, I want to mention that I work with civilians who negatively impacted by war, but I had small experience working with soldiers during the war in hospitals.
Please mention both, if you will.
Okay. Mainly what we do here, we provide psychosocial support. So we visit families who lost their loved ones and who are grieving. So we know that when we lose our loved ones, grieving is a natural process that we live. But sometimes especially when the loss is sudden, unexpected, and tragic, the level of suffering becomes very strong. And in that case, we provide them psychosocial help. Mainly we visit homes, we go villages, we go homes, and we talk to children, we talk to family members, and sometimes it's individual, sometimes it's group sessions. And sometimes when we talk to family, we see that neighbors also come and join, and they also start talking about their symptoms that they experience, how anxious they are, that they can't sleep, etc. So this is the main part, what we do. Another part is that they come to us. Those mainly it's individual sessions that they come to our office near to former frontline, people living in Tartar, Artam, Bardaitsa, this region was the war. They come to us, and this is the main part. Another how it affects us, well, as I share Artur's thoughts, that when this help is intense, of course, we also face, we also have risk to have burnout that after some period we start not functioning well. Another part is to provide trainings to other psychologists, and we give training and then we supervise them. Mainly psychologists from different regions, they come together and we go there, we provide them trainings, and then after those trainings, we give them supervision. So they bring us the cases, and then together we work on those cases, what we can do with these cases, how to approach, what would be better to implement, what strategy would be useful. This is mainly what we do here. But during the war, I only had a few days in hospitals, and there mainly all of the patients, they were wounded. It was first psychological aid, like support, like medical first, like first aid. There is also first psychological support that we provided. The main thing is to listen person, just empathically, because we have very limited time. To listen person, and many research show that when you provide first psychological help, it may prevent developing PTSD. So first psychological help may prevent people to develop trauma-related disorders later. This is mainly what we do.
Actually, I have a question for both of them, if that's okay.
Mm-hmm.
Yeah, okay, it's just a short one.
Sure.
So to Rovshan first, and then we can go to Artur maybe, if you want to input. I just wondered, like, do you think there is, who is more likely, sorry, to seek? So would it be women or men? Because I know typically, I mean, I know it's not good to kind of generalize, but I think typically, I feel like men are a little bit more reluctant to seek any help. Would you agree?
Do you want me to answer?
Արտուր ջան, խոսքը վերաբերում է թե ով է ավելի շատ դիմում, կանայք թե տղամարդիկ, որտեղ ինչպես հայտնի է ավելի
Okay, can you start? Say a question for me in Armenian or
yes. Armenia, yeah. Doesn't matter, both of them.
Մենք չունենք հատուկ ստատիստիկ տվյալներ, որովհետև գրեթե դիմում են հավասար, բայց հիմա քանի որ շատ նաև աշխատանք է զինվորների հետ, երևի թե կարելի ասել, որ փոքր ինչ գերակշռում են տղաները, բայց հիմա չկա, մի քանի տարի առաջ կար, Արմին ջան կներես, sorry, թարգմանի.
So there are no statistical data, there is no statistical data to give you exact picture, but I would say that now the both women and men, they are seeking for help. In wartime and now, of course, more men are asking for help than women.
Իսկ տարիներ առաջ իր բնավ կանայք էին ավելի շատ դիմում, տղամարդիկ.
Some years ago, of course, it was more likely that women were seeking for help than men.
Բայց ներկայումս չկա այդ խնդիրը եւ տղամարդիկ ինքնուրույն գտնում են հոգեբան եւ դիմում են.
At this moment, I don't see that there is a problem. Men are looking themselves to find psychologists and to ask for help.
Եվ դա ոչ մենակ Երևանում, այլ արդեն տենդենսը կա նաև մյուս ավելի մեծ քաղաքներում, ինչպիսին օրինակ Գյումրին է, քանի որ Արմինեն աշխատում է Գյումրիում, եւ այնտեղ էլ կա շարժ մասնագետներին դիմելու.
And it is not only in Yerevan, in other regions too, the process is going. And for example, it is so in Gyumri, where I work in psychological center.
Thank you. Thank you, Artur.
Thank you.
Rovshan, please.
Aysel, can you please repeat the question?
Oh, sure, no problem. I mean, to put it in short, who would be more likely to seek it out of women or men? Do you think you have like some sort of, even if it's personal data, like maybe you notice something like that?
In our cases, in my case, we visit homes. So we call people and visit home. Mainly we go for them. And they're both, we also talk with women and men. But within civilians, I would say that mainly women are seeking for help. And also they worry about their children a lot. So they bring their kids. Men who experience trauma-related symptoms, sometimes they distract themselves. They do something and they distract. So it's not common that they come to us. But those people who come to us are mainly women, and they bring their kids. But in general, of course, soldiers, military personnel, they're men, like majority, or I don't know how many percentage, but they are men, and they seek for help. Some of them seek for help, some of them they don't. There is also barriers of seeking psychological help, because imagine that people who were in war comes, psychologists sits in front of, let's say, 25 years old girl, and then talk. Why I use this word, because I want to show the reality. My sentence may not be politically correct, but this is the reality. This is how they see this process. So they say that I'm a war veteran, and how can you help me? So mainly, this is why mainly they seek mainly psychiatric care rather than psychological care. But of course, if the psychological interventions are let's say effective, they after some period they start visiting psychologists, like they become more engaged to this process. To answer to your question, we visit families, but civilians who came to us, mainly they're women and kids, they bring their kids. And soldiers, some of them seek for help, some of them doesn't, but mainly they seek for psychiatric help. They need pill rather than talking. This is what they say, I mean.
Thank you, Rovshan. Thank you. For our next question, we have Janine here with us. Janine Mitchell, please ask your question yourself.
Thank you. Well, thank you to the organizers of Bright Garden Voices and to the speakers today for yet another excellent event on this important topic. My question is actually related to gender, what we were just talking about. And specifically, I wanted to ask how mental health services are responding to both the gendered experience as well as gendered narratives of the war. So for example, as was touched on already, you know, soldiers are overwhelmingly male. You know, they have a different experience of the war, but they're also embedded different narratives about the war. Many of them, which, you know, many of these narratives tend to emphasize masculinity, which can include not taking recourse to, and for women too, you know, we see narratives of women during wartime that is strong, encourage them to be mothers of the nation. You know, also, I think the fact that this war happened during COVID, this adds an additional dimension of psychological stress for women who were already disproportionately dealing with a lot in the home for traditional family structures where women were taking on the responsibilities of educating their children and taking care of the home as well. So how are mental health services responding to dismantling these narratives that would perhaps discourage people from getting help? And specifically with women, it sounds like in the example of Azerbaijan, people were going into the homes and so they had a chance to interact with them. But in Armenia, how are the needs of women in particular during wartime being addressed? Thank you.
Who wants to go first? I also entered the question in the chat so everyone can see. Rovshan, are you ready to answer?
Sorry, but the question is not clear for me. Sorry, I missed something.
It's okay. Janine, would you just give a simpler summary?
Very briefly. Yes. How are mental health services responding to the needs of women and men differently during the post-war period? And in particular for women, because of the narratives surrounding the role that women play in the war, how is mental health services addressing this, addressing these issues that may be discouraging women from seeking mental health services?
I don't have answer to this question. No, probably I need to search to look for something, then come back to you. But for now, unfortunately, I don't have answer for this question.
Microphone.
Հարցը մի հատ կարճ
Ես մի հատ հարցը ձևակերպեմ քեզ համար։
Շատ երկար է։
Ժանինը փաստորեն հարցնում է թե հոգեկան առողջության մասնագետները ինչպես են նաև կանանց հարցերին արձագանքում, որտեղ պատերազմում հիմնականում զինվորներ են եւ առնականության այս մասկուլինիտի խնդիրը շատ ավելի առաջ է դրվել եւ զինվորները տղամարդիկ են, իսկ ինչ խնդիրներ ունեցան կանայք, ովքեր անն էին եւ COVID-ի պայմաններում այս պատերազմը տեղի ունեցավ եւ արդյոք կանայք ստիպված չէին չդիմել հոգեբանի, թե ինչպես է ընդհանրապես կանանց հոգեբանական աջակցության հարցը դրվել։ Rovshan այդ հարցին պատասխան չունեցավ, հիմա դու պետք է ասես։
Կանանց աջակցման հարցը նույնպես շատ կարևոր է ու առանձնահատուկ ոչ մի տարբերություն չի դրվել։ Աշխատել են մարդկանց հետ, ովքեր դիմել են օգնության, օրինակ այրերը կամ որտեղորուս մայրերը։
I don't see a big difference in Armenia from mental health provision for men and women because whoever was asking for help, they could get help. A lot of mental health support could get, and they receive till now, mothers who lost their sons or other women, female family members. So I don't see big difference between this gender-based approach.
Իսկ կապված COVID-ի հետ, COVID-ի ժամանակ նույնպես ձևավորվել էին մոբիլ խմբեր եւ հոգեբանական աջակցման կենտրոններ բացվել էին հատուկ COVID-ի ծրագրերով.
And in connection with COVID, in Armenia were functioning many mobile groups helping people who suffered from COVID, and during that time they could get mental health support.
Եվ մեծ ծավալով սկսեցին COVID-ի ժամանակ աշխատել on-line թերապիաները.
And during COVID, in big scale, online therapies were happening here.
Եվ դրա համար չեմ կարող ասել, որ կա ինչ-որ առանձնահատուկ տարբերություն տղամարդկանց եւ կանանց.
That's why I cannot specially mention about any special difference between mental health support for men and women.
Thank you.
Thank you. Rovshan, was there anything you thought of you wanted to add about, the narrative of women's role in the war, the men's role, and how did that impact the way you, the way mental health professionals and people seeking help?
For me, it's a very difficult question. I think I need some time to search for something to look at because I just don't want to just reply, but I want to really answer. This is why I don't feel that I can answer to this question.
Of course, later on we can, post it on our social media pages and etc.
Yes, I copy and pasted the question.
Excellent.
So I'll come back to you.
Thank you. We have a question about the links between these wars and drug and alcohol abuse and use and homelessness and mental health. How these go together. So what impact have we seen in the conflict, but like perhaps in this war specifically? Do we expect a rise in drug and alcohol use and homelessness, especially for the veterans? We can start this time with Rovshan.
Unfortunately, we see the increase, and unfortunately, we have to expect this increase. Why it happens? People who are traumatized, as I mentioned before, they have intrusive thoughts, intrusive memories that come and they get terrified. So this doesn't happen 1 day, 2 days, or 3 days, but it's constantly happening. And people need, the person needs to do something with this. So either the person can deal this in a healthy way, like seek for help, psychiatric help or psychological help. And the other way is distraction. So the person starts to distract himself in order not to leave this disturbing feelings. So and alcohol use and drug is the way some people do. Some people may distract himself, let's say, by listening music with headphones. And some people may drink, some people may inject drug, and it's very common, unfortunately, that people participating in the war, in the future, there is an expectation that these numbers will raise. The use of alcohol, drug will raise, and even suicide we can see in both countries that people participating in the war, they suicide, they attempt suicide, some of them suicide. So unfortunately, yes, we can see this increase.
Arthur, if he may go to you.
Arthur հասկանալի է, խոսքը
Չէ,
թմրանյութերի, ալկոհոլ։
Արնոլդի խոսքը հասկանալի էր։ Դա իհարկե միշտ այդպես է, աղետներից, պատերազմներից հետո միշտ մեր գոլեգաները, ինչպես եւ Արմինեն է մասնակից եղել երկրաշարժյան աշխատանքների, Անժելա Վարդանյանը, ով երկար տարիներ Գյումրիում աշխատել էին, կար այդ տենդենսը ալկոհոլի եւ թմրանյութի։ Արմին թարգմանի։
Yes, it is so. Always after disasters, after wars, this tendency is evident, and some specialists here sitting together with us, they know that it is so. So the rise of drug and alcohol use, of course, will happen.
Եվ իսկ իմ սեփական դիտարկումները 2016 թվականի պատերազմից հետո դա հիմնականում օգտագործում էր կոնտուզիա տարած զինվորները։
Arnold ինձ օգնի կոնտուզիան concussion, yes. My very personal opinion and experience showed that after 2016 short war, I mean, it was 4 days war. Karorya, 4 days war in 16. The drug and alcohol use was typical to people, they had concussion.
Եվ ինչպես նշեց Rovshane, կան սուիցիդալ փորձերի եւ սուիցիդների տենդենս։
And as Rovshan mentioned about suicide, yes, there is tendency for suicide and suicidal ideas.
Եվ մենք հիմա մասնագետներով նաև անդադ քննարկում ենք այդ հարցը, որովհետև ամբողջ աշխարհում է հասանելի թմրանյութը եւ
This is an important question to be discussed among professionals because drugs are available in all the world.
Եվ դա հասանելիությունը մեծ խնդիրի առաջ է կանգնեցնում, քանի որ մարդիկ ունեն իրականության մեջ խնդիրներ։
People, they have problems in reality, in their reality, and as the drugs are available for people, of course, it is increasing problems.
Եվ դրա համար մենք հիմա փորձում ենք ավելի մեծ ուշադրություն եւ հատուկ այլ ծրագրեր մշակել հենց թմրանյութերի օգտագործման, կանխարգելման եւ իրանց այդ աշխատանքի վերաբերյալ։
That is why we are now trying to give big attention to drug and alcohol use as a consequence and to try to organize some projects to prevent this process.
Եվ չգիտեմ ինչքանով կկարողանանք հաղթահարել, բայց փորձեր անում ենք։
We are trying, and but I'm not sure how successful it can be. But at least we are trying.
Thank you.
All right, thank you. We are almost out of time, but there is a interesting question here I wanted to ask. it is about people with PTSD or somehow mentally affected by the war and dialogue. How do they, what's the relationship with both? Can, dialogue with an enemy, affect your mental health, suffer during a war in any way? These people you consider enemy. So would you please elaborate a bit on this? Who wants to start? Let's go to Rovshan.
Sorry, can you please, relationship between PTSD and...
Yes, someone asked about the relationship between PTSD from a war, etc., and how dialogue could affect it. And I believe the person was asking maybe dialogue with the other side, with the enemy side, I guess.
So, so how can dialogue affect to person having PTSD, right?
Yes, I'm guessing perhaps if part of the trauma is, associated with this enemy side, if that makes sense, from a war, then would dialogue help or hinder, or would it at all have an impact?
Okay. I don't have much information about this. I use different therapy methods, as I mentioned, like exposing yourself to those thoughts, to those memories, to those places. But talking with other people help usually. So people experiencing, people having post-traumatic stress disorder, after some time, they also develop depression. They isolate themselves. So I can see dialogue within this context, but talking to someone whom you fight, can it help you to process those? I don't know, but it's a very interesting question.
Artur, if you can very, very briefly, since we are well over time, would you?
Ասում է այդ PTSD տարած ինչքան որ հասկացել եմ Արնոլդը ինձ կօգնի իհարկե արագ ասեմ ես PTSD տարած մարդիկ post-traumatic stress-ի տարապող մարդիկ եւ դիալոգը ինչ հարաբերության մեջ են այսինքն ինչպես այս երկխոսությունը կարող է ազդել այդ մարդկանց վրա այսինքն այն երկխոսությունը որ հիմա տարվում է որտեղ երկխոսությունը աստորեն թշնամու հետ է եւ այն մարդիկ ովքեր post-traumatic stress-ային խանգարումներից են իրանց վրա ինչ ազդեցություն կունենա
Իհարկե հարցը շատ լավն է, բայց միևնույն ժամանակ ինքը շատ ժամանակ է պահանջում հարցի համար, բայց երևի թե պետք է ամենաառաջինի բանը, որ սա կլինի օրինակներից մեկը.
It's a good question and we need time for it. Time is needed. And the last thing that maybe this will be an example for other cases.
Որովհետև շատերը կմեղադրեն, շատերը կվատաբանեն եւ երկու կողմում էլ ինչպես Ադրբեջանում, այնպես էլ Հայաստանում.
Both in Armenia and in Azerbaijan, many people will accuse, will criticize.
Բայց մենք չպետք է վախենանք այդ հարվածներից, որտեղ այդ հարվածները էմոցիոնալ ազդեցության տակ են.
But we shouldn't be afraid of those attacks because these attacks are happening because of emotional confusion under the emotions.
Իսկ մենք այսօր գտնվում ենք մասնագիտական հարթակում.
Today we are in a kind of professional framework.
Եվ դա օգնում է, որպեսզի մարդիկ փորձեն հասկանալ, որ մասնագիտական դաշտը դա քաղաքական դաշտ չի։
And people, they have to try to understand that professional field is not the same as political field.
Եվ այդ երկու երկխոսությունները դրանք հասուն մարդկանց, այսինքն երկխոսությունը մարդու միջև դա խոսում է մարդկանց հասունության մասին։
And the dialogue between people tells us about maturity of people, about being mature enough.
Եվ մենք 2 ժամ արդեն այստեղ ենք եւ կան հայեր եւ ադրբեջանցիներ։
It is already 2 hours we are together. Here are Azerbaijani and Armenians,
բայց չկա ոչ մի քաղաքական կոնֆլիկտ, այլ կա զուտ մասնագիտական քննարկում, որովհետեւ կարեւոր է օգնել մարդկանց։
But there is no any political conflict. There is professional dialogue for helping people.
Thank you, Artur. I think we should wrap it up, Diego.
Yes, we want to first of all thank everybody for joining today. Sadly, we are running out of time, and I know we have a lot of questions unanswered. So what we're going to do is we're going to collect these questions, and we're going to politely invite, if possible, to Rovshan and Artur to chat, which is a new thing we're doing on Instagram, where we might ask some of these leftover questions. You don't need to accept. This is just an option we're giving to follow with these very interesting questions we had, because this is a very important topic, and I think it's very, as our last question mentioned, for some people at least, it is healing to hear these things. So if that can help, then we're happy to do so. So yes, thank you everybody for joining, and I wanted to invite you, Rovshan and Artur, to say some closing remarks so we can finish this meeting. You want to go first, Rovshan?
Thank you for inviting me to talk about this topic. I hope that we could somehow answer to some questions or clarify something, or to describe a picture, what we do in both sides. Thank you.
Դա իրականում շատ հետաքրքիր դիալոգ էր, եւ ես կուզենամ ավելացնեմ մի բան, որ առհասարակ դա չի վերաբերվում մենակ Ադրբեջանին եւ Հայաստանին, եւ կարեւոր է, որ պետությունները երեխաների կրթության եւ դաստիարակման կազմակերպման մեջ անել այնպես, որպեսզի բացառեն հարևան ազգի նկատմամբ ատելությունը, եւ բացառելով փոքր տարիքից ատելությունը, մենք միայն ու միայն կկարողանանք նոր սերնդում ունենանք պատկերացումներ։
It was really an interesting dialogue. What I would like to say at the end is this is not only Armenia and Azerbaijan issue. This is more wide, and I would wish that all the states and governments, they try to organize an education which will exclude any aggressiveness, exclude teaching any aggressiveness towards to any ethnic group of or nation. That is all what I want to say.
Եվ միայն նմանատիպ կրթություն եւ սերունդ ունենալով մենք կարող ենք հասնել այլ մակարդակին, տեսնելով օրինակ Եվրոպա.
And we can achieve a different level through good education and like somehow it is in Europe.
Thank you very much, Artur. Thank you very much to Aysel and Mariam, our debuting co-host for this meeting, and to everyone involved in Bright Garden Voices team. There's a lot here, our designer, Filan, Gaine, Leila, everybody, Andrea, Arnold. So yes, please, you can put the questions that were left unanswered. You can put them now on the chat. If not, we might tweet as well, and you can send them on Twitter, and we will see if we can answer them in the future. And we will also share the documents that were mentioned by INDPs, and I think that was another one also mentioned. We will share those information as well. So thank you everybody for joining. It was a pleasure to have you on again after a long hiatus we had, and we hope to see you soon. Thank you very much.
Thank you.
Thank you very much.